Hello Africa, you're welcome to a new season of HealthAfrik where we'll be focusing on raising awareness about bone diseases. This discussion is brought to you by the Association of African Universities, and you can follow this discussion on our social media handles at Association of African Universities on Facebook and YouTube, and AAUTV_African Universities on Twitter. So Doc, let's say I am a medical student watching this show. I would like you to tell me some expectations I'll first encounter with a patient diagnosed with arthritis.
So it depends on which specialty you are working with, and what stage of the disease or the condition the patient presents with. What you should expect is to have somebody with pain in a joint, and it's a question of evaluating it. The idea for a medical student is not to think in a closed box, but to keep an open mind and realize that it is a person with a painful joint. It is not a painful joint. Okay, so first you have to evaluate your person as a whole and then evaluate the joint. And remember, some of the things that would cause trouble in the joint for which the person came to see you might give you issues outside the joint. So yes, it is, if you are working with a rheumatologist, yes, then you'll find that you end up having to evaluate the kidneys, look at the skin, look at the eye, look at the heart, look at the different other joints, okay? By the time people come to the orthopedic surgeon with joint pain, then usually they're coming with a very specific joint issue. And invariably, they either have gone to the rheumatologist or they did not see the rheumatologist, and you might have to say, look, with this particular condition, I think you are better off seeing the rheumatologist. It doesn't stop me from intervening. There are people that I've operated on, but I will tell you that I think your problem is inflammatory and you are better off seeing a rheumatologist. My life is easier, your life is easier that way.
Okay, so let's say I want to intervene. What first aid tip would you recommend for me as a medical student?
Oh, I say, so it depends on what the person is coming about with. I think that if the person is coming with pain, as a medical student, you're not really in a position where you can intervene because you're not qualified to do that. But the idea is that you can be empathetic enough to listen to the person and get the person to tell his or her story, and to do it in a way that you can really tell what is important to the person. Okay, there are people, and you'll be very surprised, there are people who come in with, I recently operated on a gentleman. He has bad knees, horrible. I had to do knee replacements both sides. The real thing that was important to this gentleman is that his marriage is being threatened. Marriage? Yes. Yes, because he's finding it difficult to keep up with what he has to do as a husband because his knees are killing him. Okay, so if you do not understand what is important to the person, you might be happily fixing the person's knee, but he's not very happy. At the bottom line is that this gentleman came to see me 6 weeks after surgery, and he came with us in the company of his wife, and with the type of questions that they were asking me, I just had to go find literature to reassure them and let them know that, look, this is the way to go and your problems will be sorted out.
Have there been any collaborations between Boss Medical Center and other educational institutions and research institutions in terms of research on treatment and diagnosis for arthritis?
In terms of research and treatment of arthritis, not necessarily, but in terms of training of residents and medical students, yes, I do quite a lot of work with the teaching hospitals, the University of Ghana, and the University of Ghana Medical Center, and also with the Kolebu Teaching Hospital. Yes, I have had to do some work with the Konfanochi Teaching Hospital at some stage, and I have had to do some work with the Cape Coast. And I've made some visits to the Ho, the medical school there. So it's mostly in the terms of training of residents and faculty and that kind of stuff. Yes.
So let's say I'm a medical student, I want to come to BOS for training. What are the requirements and processes I need to pass through?
So for a medical student, that would fall under studentship or visiting. Okay. And really, we're not really hard and fussy about that type of thing. The idea is that we need to be ascertained that you are a properly accredited medical student. You need to be from a medical school that would be recognized, because there are legal and ethical implications with that. We may not necessarily need to get into the medical and dental council things, but at least with we need to know that you are from a good medical school, and that there is a specified requirement that you can meet, you are expected to meet. Otherwise, we're not fussy about that.
All right. Thank you very much, Dr.
You're welcome.
Would you like to tell us your final words for students and then our viewers?
Mostly for the viewers, the idea is to recognize or to remember that arthritis is a condition that occurs in all cultures across the world, in all environments, both affluent and non-affluent, in the first world, in the third world, in the young people, in elderly people, in educated, non-educated. I think that our purpose on this earth is not to make life difficult for ourselves.
Not at all.
What we need to recognize is that it's not every joint pain that is arthritis, but if it is arthritis, there are solutions for it.
Right. And then to our students?
To the students, I think keep an open mind. The fact that somebody comes in with a painful joint doesn't necessarily mean it is arthritis. There are other things that could mimic that. And that if it's arthritis, sometimes it may not necessarily be osteoarthritis, there may be something else. And if it is some of the inflammatory arthritis, your painful joint might not be the only thing to worry about, but remember to look at the person's neck, which might dislocate, or to look at your kidneys, which will kill you.
All right. Thank you very much, Doctor.
You're welcome,
We really appreciate you having us for this discussion.
Thank you too.
This brings us to the end of today's discussion, where we talked about arthritis with Dr. Joseph Ogyaadu, an orthopedic surgeon at BOS Medical Center. If you just joined us, you can follow the discussion on our social media handles at Association of African Universities of Facebook and YouTube, and AAUTV_African Universities on Twitter. I am Isabella Teta Ahinakwa, hoping to see you on our next episode.